Urinary incontinence and retention. Urinary incontinence is an uncontrolled leakage of urine. The prevalence of incontinence is higher among older adults, but it's not a natural consequence of aging. Causes of urinary incontinence includes confusion or depression, infection, atrophic vaginitis, urinary retention, restricted mobility, fecal impaction, and use of drugs. Urinary retention is the inability to empty the bladder despite urination or the accumulation of urine in the bladder because of inability to urinate. The cause of urinary retention is mainly due to the dysfunction of the urinary system. This includes the obstruction to the bladder outlet and the impaired contraction of the bladder muscles. The evaluation for urinary incontinence and urinary retentions includes a focus history and physical assessment, urinalysis, and a bladder log or a voiding record. Managing urinary incontinence includes adequate amount of fluid consumption, removing anything that can irritate the bladder, maintaining a voiding schedule, bladder and pelvic floor muscle training, or the use of incontinence medication or surgery. Acute urinary retention is a medical emergency and requires prompt recognition and bladder drainage where a catheter may be indicated. We should also advise the patient to avoid drinking large volume of fluid or large volume of alcohol. They should also warm up before urination and they should have a scheduled toileting.